Welcome back. We are answering your questions about the coronavirus vaccine with Cone Health Chief Pharmacy Officer Dr. Deanne Brooks. So this question is the vaccine safe for people who are allergic to eggs? And we hear that a lot because of the flu shot.
Yeah, so neither of these vaccines that are currently under emergency use authorization have any egg in them. And so anyone who has an egg allergy can receive the COVID-19 vaccines.
Okay, and this person says, some people say members of the Black and Latino communities were not involved in the vaccine trials. Is that because it's not safe for them?
Oh, so that's really important to address. So first of all, just to answer the question, nearly 1 in 5 volunteers in the studies were from the Black and Brown communities. And we do have to address some reluctance among this community due to the mistrust that we have had in our past over unethical treatment and scientific research. And so it's something that we're continuing to address in our Black and Brown communities, and particularly because they have nearly twice the likelihood of having significant complications to COVID-19 vaccine. So we really want to encourage them and help them understand the safety of the vaccines for them.
Okay. If you've already had COVID-19, do you need to get vaccinated?
Yes, you do need to get vaccinated. Now, it depends on when you've had COVID-19. The state of North Carolina requests, or actually you can't get the COVID-19 vaccine if you've had COVID-19 within the last 30 days. And the national guidelines, the CDC guidelines for that are that really they're recommending maybe wait for 90 days just because right now we have limited supply of the vaccine. And we do have some evidence that we have natural immunity up to 90 days, but we don't know how long after that we have natural immunity. And so the COVID-19 vaccines will last longer than if you contracted it yourself.
All right, this person says, I've heard people aren't feeling many side effects from the first vaccine shot, but they feel more side effects after the second vaccine shot. Have you been hearing the same, and why?
Yeah, so we have seen that typically folks will get a little bit more side effects from the second dose, and a lot of that is due to our immune response. And the good thing is that there are very few serious side effects that occur in terms of percentage with the COVID-19 vaccine. You've heard of some allergic reactions that can occur, and that's also part of why we observe our patients for 15 minutes at least. And but yeah, I've talked to folks who have had both vaccinations, didn't have trouble with either one of them, and I've also talked to folks who said, yeah, the second one they had some more, and it's like that immune reaction, some fever, some chills, just feeling yucky.
Okay, this person is asking, I need to know how to sign up for the vaccine through Cone Health.
Great. So we have an online sign-up process through MyChart. We also have a phone number that folks can call, though right now we don't have any open appointments available. And we are swiftly working to increase our capacity. And we hope to be able to announce something later this week that will be going to a larger location, and at that time when we are able to firm all of that up, we'll be opening up more appointments, and people will be able to schedule them through MyChart or to call and schedule those appointments.
Yeah, I know it's hard to be patient at this time because everybody just wants the vaccine. They want to make sure that they get it, and they don't want to miss out. But it's coming down the pike, little bit by little bit, as we learn. Okay, this person has said, how does each county know how many shots to get for each phase? Could you miss out if you're wanting one and you can't get in to make an appointment because everyone's trying to make an appointment?
So you won't miss out. We will have enough vaccines for everyone eventually. And some of us do have to wait our turn to get our vaccine because we really are working to vaccinate the most vulnerable first. And so, And each phase, so right now we're in phase 1B, but we're still vaccinating phase 1A, and we're in group 1 of phase 1B. Once we move to group 2 and 3, we continue to vaccinate everyone above them. So it's not like there's a cutoff.
And this person is asking, are you given a date for the second shot when you get your first shot?
Yes, you are. So if you receive the Pfizer vaccine, you'll receive an appointment for about 21 days after the Pfizer vaccine and for about 28 days after the Moderna vaccine.
Okay, and they get that on the spot, or do they wait for that and then have to call and make another appointment?
Yeah, at Cone Health, we are going ahead and scheduling that appointment for them then.
Okay. All right, we're going to continue to take your COVID and vaccine related questions. That's coming up right now. Next.